Good afternoon. Thank you very much for the invitation to the American Psychological Association. It's a pleasure for us to be here. I'm going to have bringing all of us to perhaps thinking of a different aspect, of very important aspect of this discussion, which is the mental health and the psychological contributions and aspects for gun and violence. APA views violence as a public health issue that has very important psychological aspects. And that, since it's a public health issue, following the public health model, it would require a multidisciplinary, collaborative, integrated efforts to deal with it. Also, bringing, the conversation about gun violence in terms of, mental health and behavioral health issues. Gun violence is an extreme expression of aggression and conflict resolution. So, if we can, shift our minds in thinking about, the decision about using gun, the causes and everything that comes with. Aggression is affected by norms, beliefs, values, upbringing, the life history, and other, determinants. Promotion of healthy psychological development may discourage resorting to gun and violence. This is assumption. There is very little to see. So those are the major questions that, all over you go these days. I was coming in the metro. I live here in the area. And the Express, the free paper that, the Washington Post has, yesterday had a big why, So why? Why it happened? How does it happen? So that's why the questions that, we would like to be part of the discussion and the research and contribute with our interventions. So who's most at risk for engaging in gun violence? What contributes and makes the difference in the decision to use gun to resolve conflicts? How to prevent gun violence? And what are the contributions that our field can bring to this discussion and to the research area? We can help understand the likelihood of engaging in gun violence. We can help with developing evaluations and interventions because most of the violence prevention, I'm from the prevention field, prevention of interventions of child maltreatment, youth violence prevention, and other types of violence. Psychologists are the front. Developing intervention, evaluating interventions, developing assessment tools and evaluation scales and etc. So we have much to contribute in identifying who's at risk to use guns. And also treatment. It's very important for us also to consider in the gun violence discussion all the spectrum that we have, from the prevention, from the incidence, and then the treatment of those involved with the violence and trauma, which is a very important area of psychology also. So how do we contribute to this conversation and to the research and the field? Oops, it's not moving. Can someone? Now, I'm going to, next I would like to talk to you about the different areas of psychology. And, yeah, that's it. The different areas and fields of psychology and how each one of them can help us to think about and propose suggestions for research. For instance, the issue, the field of developmental psychology. What individuals' trajectory and history can help understand the resort to guns? We know that, for instance, child maltreatment can lead to other forms of violence, involvement in other forms of violence, with the team violence, with intimate partner violence. Parents who have been abused themselves, they are more likely to be abusive of their children. Families that have domestic violence are more likely to be places where child maltreatment happens. So from that area of knowledge, what can we learn? How can we transfer that to understand what makes a person to use, guns to resolve conflicts? Alcohol is also a very important factor. So what are the risk factors in the person trajectory and history of life? We know the adverse childhood experiences. How much, we now know of the effects of, children being exposed to trauma, to violence, to abuse, and mental illness, and drug abuse, and etc., in their own risky behaviors later. Social psychology. So thinking about social psychology, how can we help? How can we participate in that? We would ask, what leads someone to become overly enamored? And that's a word that I thought, overly enamored of using guns. So what makes a person, do that, to use this to respond to a conflict? What circumstances make a person to use guns? What kind of, situations, conflicts are more prone to that? What is the psychological impact of a gun ownership? Recently, some people have been referred to, like, why women want to use guns, because this empowers them. So what is in that is contributing to a person to feel gun ownership gives them some psychological attributes and advantage that makes them more powerful because they have guns. So what we'd like to know about that. And are the societal norms and values that particularly related to gender, for instance, and age? We know that most violence are committed by men, by males, and of a certain age. The certain age that matches the developmental stage, adolescence, that also are adolescence and early adulthood. Moment also that many serious mental health issues are identified. So what is this correlation of those, different things that can help us to understand? So, what makes a difference for a person to use a gun? Why do a person choose to use a gun when there is a conflict? What makes the difference? In clinical psychology, a clinician or, research that is, for clinicians and, individual approaches. So what are the kinds of mental health issues that are more related to gun and violence? Dan Webster did a wonderful summit early in January. And one of the chapters in the book that is amazing, out like a month later, which is fantastic. I mean, we were all in awe and say, how can he do that? And then one of the chapters talking about mental health saying, well, we know suicide is more related to depression and bipolar with other kind of homicides. And drug abuse related to, intimate partner violence. So what do we need to know? What is the research that we needed to put in place that will help us understand what are the mental health issues that are more related to gun and which ones, and which violence? So what extent is susceptibility to use the guns due to mental health? Is mental health really a factor, and how an important factor is mental health? So, and what measures do we need to have? Psychology has several, measures for different things, a lot of different things: personality, intelligence, risk for this, risks for that. So, what would be the most effective assessment measures that we can develop or we can adapt to identify those more at risk? And what is the interaction between depression? That is the most common mental health issue that we have in our societies. And what is the relationship between being depressed and using guns for suicide and other kinds of violence? Is there a role for age and gender? What is the fact that most of violence is committed by men of a certain age? What is the role of violence as a symptom of mental health problems and how it might relate to gun violence? And then also community psychology, because most of the incidents happens in the communities. So how can we understand from the community perspective the gun violence, the incidents, the causes, the circumstances, those who are involved in gun violence? How do the laws and policies affect that? the interest in using, if the perception of legislation, of lack of legislation, of no enforcement of legislation, would that have an impact? Also, what's the role of the systems? We all talk about, well, what to do when the next question comes and say, well, what to do? Where do we go? Everybody look at what are the systems in place? How can we help? How can we prevent? How can you address this? So what are the systems involved at the community level, state level, federal level, that will help us to prevent and treat those? So, but we know some things from decades of research that our members and others have been conducting on risk factors for mental health issues. And those are the things that we know from studies that have been conducted in the past 2-3 decades, that risk for mental health are pretty identifiable in terms of going to and then using some of the measures. Temperament is a very important thing. Prenatal exposure to alcohol and drugs, genetic basics. We now know that genetic base for schizophrenia and for depression. A very important one is the family interactions. What is the childhood experience that individuals have, and what is the role of that? And traumatic stress and exposure to violence. And a very important one that has been more recently researched is the connection between cognitive vulnerability, which is defined as many of us, we have more vulnerability to see things from the negative. So if you have adverse situations and stresses, and especially like abuse, individuals more likely to develop a negative view about their own experiences. And that is something that can lead to depression, and depression to involvement violence. We think that the early identification of those factors would help us to design and implement and evaluate interventions and treatments that will contribute to more healthier long-term outcomes. So what do we know? That early exposure to abuse and neglect, they are risk factors for other types of violence, as I said, involvement in the teen years, IPV, and being abusive. Child maltreatment is more likely to be perpetrated by parents. And parents and caregivers are very important and critical people. We also know that there are some interventions that have some good level of evidence. For instance, parent training, home visitation. So they have varying levels of evidence, but they have very good ones to help reduce child maltreatment and to reduce the exposure to adverse childhood experiences. All of us know about the NRAP system, the blueprint system, where we can find where are those most important and evaluated interventions. We also know that cognitive behavioral therapies are effective in treating depression. We also know that there are many trauma-focused, evidence-based cognitive behavioral therapies for those who are victimized by violence. And I give some examples: the parent-child interaction therapy, the trauma-focused CBT, and the children psychotherapy. So what can we do? Psychology's critical interventions that first promote healthy psychological development, promote nonviolent ways to resolve conflicts. Because remember my first slide is like gun is an extreme form of aggression and violence and to resolve conflicts. So if you can help people to resolve conflicts in a different way, identify how individuals, social situations, community characteristics might contribute to the likelihood of violence and use of guns. And we also treat effectively those. So these would be some, more specifically research questions that we came up with from, and then I, try to organize from the different fields of psychology. One would be to assess the effect of family gun ownership values, family violence, parenting practices on the likelihood of aggression and use of gun in violence. Number two would be assess what? The causes, circumstances, types of conflict, relationships, beliefs, social roles that makes a person decide to use gun violence. Then the third one would be assess the relationship between different mental health problems, access to guns, and use in different violence incidents involving guns. And test effectiveness of a community multidisciplinary integrated collaborative project to prevent use of guns in violence for at-risk population. These are kind of questions that is just to, raise us to be advocacy in terms of, what needed to be done, where do we need it to go. So what does it take for us to have, risk factor for mental health and behavioral health identified and treated? What takes us to have an effective mental health system to address those who have depression or other mental health issues and provide the services they need? And implement the different proven treatment models. We have, as I mentioned, the parent trainings and, evidence-based cognitive therapies for depression. We have, all those trauma-focused models. What can we learn from other kind of issues like was already referred here before? The smoking cessation, the seatbelt use, and the drink and driving interventions. I was talking to Linda, the Gutis from CDC at the lunchtime, and said, well, what the unintentional injury prevention branch of CDC, can help us to understand some of the things. Also, just a provocative thing, CDC is funding and has this Unity program that is citywide, is involving, it's a big effort. And it's expanding. They started in some cities, now they are expanding. The Department of Justice also support, the National Forum on Youth Violence that also addresses violence with a citywide approach. But we do not have mental health in those efforts. So that's something that, we would like to see is how can we have a mental health approach in those efforts to be part of the discussion, the interventions, and the solutions. So I know it's a pressing thing. CDC wants us to provide 2-3 research questions for research to be done in 2 years and have, the report immediately. But we can't be fooled here that it takes time. It is going to take a long, long time for us to really do something is meaningful to reduce the use of guns and especially to reduce violence. Because before gun, we need to think that there is violence. And then, this is something that will take us some decades, like, the examples that I just gave, the smoking cessation, the seatbelt use, and the drinking driving. So thank you very much for, giving us the opportunity to present about the mental health aspect of the gun and violence. Thank you.
Thank you, Julia. Our next presenter is Deborah Gorman-Smith, who's directing a youth violence prevention effort in the fine city of Chicago.